How do we define hypothyroidism, true hypothyroidism, when the heater is underfunctioning, so to speak? This is when you will see a combination, so together, high TSH, according to the lab values, and low free T4. Remember, this is 5% of the population, and these people do require medication and will benefit from medication. Now, conversely, the opposite end of the spectrum is an overfunctioning heater, a heater that won't turn off. And this is low TSH paired with high free T4. This is hyperthyroidism, 1% of the population, and they require a different medication usually. Methimazole is the drug of choice here that reduces thyroid function. And then the area that is the most pernicious in my view is sluggish thyroid, the gray area. This is where we have high TSH paired with normal free T4. This is known as sluggish. In medical terminology, it's known as subclinical hypothyroidism. Remember, the cutoff for TSH is abnormality over 4.5, up to about 7. This is 3 to 15% of the population, and there's debate over what is best in terms of how we treat these individuals. But I want to share with you some data. A 2021 observational study looking at 225 patients with sluggish thyroid. They were monitored. After 6 months, 74% returned to normal thyroid function. This is part of the reason why I'm trying to give you a cautious perspective on this, because part of what contributes to that 37% of people on medication who don't need it that we discussed earlier is people who have sluggish thyroid and they're not monitored, but rather they're put on thyroid hormone prematurely. So good news here, optimistic news, in that 74% of people seem to go from sluggish thyroid to normal if they do nothing else. Now, we'll give you a few supplemental strategies you can use to help increase the likelihood that you maintain or you return to normal. But let me go through one more data point that was trying to answer the question, maybe people with sluggish thyroid will see improvements in brain function, quality of life, energy, if we give them thyroid hormone. In fact, this question is one that conventional medicine appears to care a lot about, because there are 21 randomized control trials summarized in the Journal of the American Medical Association, summarizing over 2,000 people's experience who had sluggish thyroid and were given thyroid hormone medication. And I'll just quote, "The use of thyroid hormone therapy was not associated with improvements in general quality of life or thyroid-related symptoms. These findings do not support the routine use of thyroid hormone therapy in adults with subclinical or sluggish hypothyroidism." And again, this is why we want to keep in mind the fact that that other paper found 37% of people were on thyroid hormone and they could stop and their symptoms didn't change. It's because sluggish thyroid is being overtreated. Now, that all being said, if you have symptoms, this tells us the symptoms are probably coming from somewhere other than your thyroid. I want to make sure that we cover a caveat. The sluggish thyroid is when the TSH gets up to about 7. When you go above 7, this is where people seem to benefit. Quoting a 2022 review paper from the Journal of Internal Medicine. Generally, treatment is not necessary unless TSH exceeds 7 to 10. In double-blinded, randomized controlled trials, treatment does not improve symptoms or cognitive function if the TSH is less than 10. So this is why I'm urging caution in that we don't treat sluggish thyroid too early, because 74% will go back to normal with time and no other intervention, and because unless your TSH levels are above somewhere between 7 and 10, you will not see improvements in your symptoms. Now, if you're someone who is having fatigue or dry skin or brain fog, I hear you. And actually, I'm quite interested in this. And this is why myself and the people at our clinic have published 2 scientific papers on this to date in terms of, well, what can we do to improve the symptoms of these people? And there are 2 things that really seem to be overlooked, maybe 3. Someone's digestive health, someone's nutrient status, and someone's diet. And without going too far into solutions, I just want to recognize and acknowledge that if you're having symptoms, there are solutions.